Welcome to Hibbert Health. It's my great pleasure to have Dr. Lucy Kerr join me from Brazil. Dr. Kerr is a medical doctor in Sao Paulo, Brazil. She is an internationally recognized medical specialist, surgeon, and researcher, and she is one of the pioneers in the use of ultrasound as a diagnostic method in Brazil. Dr. Kerr received the Order of Merit from the President of Brazil and also received the Order of Merit from the Brazilian Ultrasound Society. She is a professor at the University of Alto Amaro. She has also delivered over 400 lectures to international conferences and symposia, forums, scientific meetings, and seminars. She has published over 60 articles, 20 books and book chapters, and is cited internationally in many scientific publications and books. Dr. Kerr is the president of Kerr Institute, where she teaches and lectures. She has been studying the disease of COVID-19 since the early manifestations in China in 2019. By the spring of 2020, she was studying the medication of ivermectin in the treatment of COVID-19. She has been doing conferences, interviews, classes, and direct guidance for medical doctors, city health departments, and for the overall population, explaining and teaching about the use of ivermectin in the treatment of COVID-19. Dr. Kerr is the face of the science and success of the use of ivermectin to treat COVID-19 in Brazil. Dr. Kerr, please share with us what drew your attention to using ivermectin to treat COVID-19.
I am a medical doctor and I have to know about the diseases and that can affect my patients. And very early in the pandemic, I realized that we are dealing with a different disease. The manifestations are very uncommon and very different from the flu and the common cold. I start reading the articles that come out from China. I have seen what was the disaster over there they put in the television every day. And but the problem looks like very distant, very far away. It was China. Here was in Brazil. We are far. And at that moment, I didn't realize that the disease would affect my patients and my relatives and persons that I love. Not long before I see in our country the virus. And this happened very soon, very close, when one of my employees started to getting symptoms of COVID-19. He started to cough, he started to have pains in the back of his eyes, a lot of headache, general weakness. This was the worst when I saw a shortened breath, and he could not breathe well. And I realized that I would have to do something quick if I want to save him. He was man, very big, 140 kilograms, 2 meters high, and he was a high risk. But to our happiness, just in the beginning of April, Monash University had released that article about the monkey cells infected with SARS-CoV-2. And Dr. Kelly had applied ivermectin to these cells and found that 98% of the virus die in the first 24 hours and 100% in the next 48 hours. And I said, what's the problem to use ivermectin? None at all, because it's one of the most safe drugs that we have in medicine. And I said, if it works, I can save him. And so I gave to him, the dose was from the label. And he started to become better in 24 hours. But in the second day, I started a new dose much bigger than the first one, because I said, I cannot let him keep with the short breath. And he started to become better in 48 hours. He was breathing normally.
That's wonderful.
And in just 1 week, he has no symptoms except the smell. It's much longer to return. And he tell me that up to date is not completely good as used to be before COVID. But his wife got the disease exactly the same time. In 24 hours, I gave the ivermectin. She was with no symptoms at all. No symptoms. It was incredible. At this moment, I said, oh my goodness, this is gold. Oh, this is fantastic. I have a cure for the COVID-19.
Incredibly amazing how that happened so close to home for you, so early in the pandemic.
And this has been repeated many times. I never lost one patient since I started to consulting COVID-19 and treating. And some patients had become very sick. I have to send them to hospital to take oxygen. Even so, they don't die. And the ivermectin is a very interesting drug. I mean, what was discovered? 6 function: and antiparasitic, antimicrobial, antiviral, anti-inflammatory, and anti-cancer, and increased what they say modulation of immunity, what means increase the immunity. So in places where we use a lot ivermectin this year, like in Natal, who has a lot of chikungunya, we have dengue, we have all these other virus disease, had decreased 90% the incidence of this virus disease, because ivermectin was giving for COVID-19, but also treat this other virus. Another side effect, they don't have anymore, my patients, herpes.
Yes, herpes simplex.
And when they start, after 1 month, they are taking regular the drug, they disappear. It was not by chance that they selected the ivermectin to be tested in Monash University. It's because it was a very efficient antiviral drug discovered in the first SARS-CoV epidemic. I have here a paper with 18 viruses that was very effective against one after other virus was tested and approved. The action mechanism of ivermectin to block the virus, I realized that extremely efficient because it's multi-action in the entry of the cell inside the cytoplasm. After, when they produce the proteins, very toxic proteins, and destroy all them, and after they can increase the immunity that has been destroyed by the virus. So it's many things. And before that, like a prophylaxis. Então, all phases of the COVID-19, ivermectin is good. And so I start to receive calls, because one speak to another, and all have a drug that can do a miracle with COVID-19. And so I start to receive a call of patients. My personal experience, one of the patients cured by me speaks, "Doctor, you cannot keep this knowledge to you. And you have to talk to more people and tell them there is hope to be cured." And she convinced me to make a video reporting my experience. And that went viral in the YouTube, surpassed 1,500,000 persons views until YouTube censored and moved from the YouTube. It was a joke in Brazil that we could not speak ivermectin, because if we speak ivermectin, the video was, they took off. And so many doctors say, that drug, You understand? Yes. And so when I started to treat patients just in the beginning of the pandemic here in Brazil, I quickly acquired very good experience because it was a lot of patients. And many doctors in Brazil has refused to use it, especially those who were accustomed to dictating the norms of the medicine. They want to say what the people should do. But what they are saying, there is no cure. You just have to take aspirin or Tylenol, go home, do nothing, become worse, and we go to intubate you to give a respirator. Oh, that's good. Even now that we have so much evidence, that Dr. Tess Lowry, that you interview here in the channel, as you know, a specialist in scientific analysis and meta-analysis, and said that now it's unethical for us to require double-blind, randomized, controlled trials, because we already know. So how can we not give the medication?
The evidence is very compelling. Now, the vaccine is being deployed in Brazil. How is that going?
They are giving a lot of vaccine. Here in state of São Paulo is doing more and more, but it's a Coronavac, the Chinese vaccine. And this vaccine works about 50%. And I am amazing about this because the natural resistance of the human being is 81%. You don't have COVID-19, and you are going to give a vaccine with 50% of protection. Very good, isn't? I think, do you know what I really want? That the people see science without emotion, thinking about what we are seeing. There is a lot of emotional. Even if the virus have a good vaccine, we cannot stay without a drug able to cure the COVID-19, because we have a lot of people could not receive the vaccine because have very, very low resistance, has received chemotherapy, they have transplant, people that has immune disease, people that do not like to have the vaccine. All these people need a drug. So even if you protect the vaccine, please, and what we have with the ivermectin at this moment is what Dr. Paul Murray says. It's the real science. Yes. It's the science beside the bed of the patient, seeing what is doing, what is cured, what is not cured. And so this is the real science. And now everyone wants a double-blind trial, control, and without this, it's not acceptable for ivermectin, but it's acceptable for vaccine. How is this? At least use the same criteria for both but not.
Lucy, you have such a profound effect on individuals and communities when you do radio talks or interviews. Tell me about that.
One fact that I need to report to you is that my word really impact people, especially when I speak here in Portuguese, my natural language, because it is exudes through, touches the heart, and people feel in the inside that I am there to help them. And I know how to do it, and I do know how to do it, how to cure them from COVID-19. My sincere desire is to heal everyone and see each one in great health. I always have the ability to pin down the most important thing to be publicized. And this has been the key of the success of my campaign against the COVID-19. I know what I am doing and how to do, and I managed to save many lives in Brazil since I start with the ivermectin. And I would like this campaign be placing every part of this world and save many lives.
Can you tell me about how your work has taken you beyond your own practice, where you've been treating and curing patients with COVID-19, and the inroads that you're having and have been having with the city health departments and other political members of the community? And how quickly have they been adopting the concept of using ivermectin, or actually instituted the treatment of ivermectin in their community?
We have reached a lot of people, not with the mainstream media, understand? For example, let's say another way. Very large hospitals in my city are not adopting early treatment. And many patients die because of this. And they come to me when they have the pneumonia and the hypoxia from the COVID-19, and they ask me what they should do. And I know that the hospital is not going to give the ivermectin. So what I do, I have this patient in my video, and I make a very detailed consultation, give a high dose of right away of ivermectin, and I prepare a kit from them to take to the hospital where they receive oxygen, because they need oxygen. All of them, I ask to have the oximeter. I ask them, if possible, to avoid being intubated, because if they do, they will not be able to take the drugs in the kit. High doses of ivermectin in doxycycline. Everyone managed to avoid intubation. And the first 24 hours, this is the incredible, was when they receive a little bit of oxygen and the ivermectin, they start to improve. I have one couple when the man was very, very sick. He used to be athletic, so he thinks he's very strong, he don't need treatment, and they start to become worse. And when I have the consultation, he has only 82, 83% of oxygen. I said, you have to go, but just now, I'm going to give you 21 pills of ivermectin. You are going to take this, you take the kit, go to the hospital, take oxygen. But when he arrived in the hospital, the doctor said for his wife, probably we have to intubate. She was very worried. She went back to her home. Next day, she called the doctor and said, oh no, was not necessary. He improved the oxygen. Now it's 94%, 95, 96%. And 3 more days, he was out of the hospital. And all the doctors working in the big hospitals in Brazil, in São Paulo, they have no option except accept the direction of the hospital. No option. They cannot decide by themselves what they are going to do. It's very sad, but this is what happened at this moment in Brazil.
Lucy, can you talk about how you've been working with local governments and how supportive have they been and are they with your initiative of introducing ivermectin into their towns and communities?
As a matter of fact, the situation is very politicized here in Brazil now. But we are in contact with the influential group of doctors to support this early treatment of COVID-19. Businessmen, they want to cure or prevent the disease. They need productivity from the workers. So it's much easier to speak with them. Yeah. They are accepting orientation. They understand the results. Recently in Ribeirão Preto, they gave this preventing treatment, and they achieve a reduction of the cases because they do not just treat the workers, but also all the relatives, all the contacts with these workers. And so they reduce the amount of cases in Ribeirão Preto, all the city, just with this action.
Lucy, what you've done in so many communities in Brazil is really amazing. Can you tell me another one of your incredible stories of how you brought ivermectin into a city in Brazil?
I have a good friend of mine in Belém who got the COVID-19 around June, July, and he was 2 weeks very bad. And when I called him, he said, I'm very sick, I feel like this. I said, oh my goodness, take ivermectin. Take ivermectin today, now. And he took, and like the others, 48 hours, 3 days, he has no symptoms anymore. He was, ivermectin, fantastic. And there is a very nice point about this doctor. He is a director of a big health plan care. You understand? The biggest in Belém. And he decided to give, after this day, for every people who enters in the hospital. Also, he decided to talk with the mayors, and they put several places to distribute the ivermectin. So was in the early treatment, in the hospital, in the city, in many places, every places that they have accumulation of people, they distributed the ivermectin. Today, you are going to see the incidence curve of Belém. After you start ivermectin, was like this. No more.
Wow.
Just this. And they have a big religious part. They call Círio de Nazaré, is the name. Círio de Nazaré.
Yeah.
A huge population they form. Even so, do not change the incidence. At this moment here in Brazil, the medical doctors are divided in 2 large groups. And so these 2 groups are fighting each other. Our federal government, Board of Medicine, are telling us that we can do all the treatment we think is correct. They are protecting us against these doctors. Said, no, you have the right to prescribe what you think is correct.
That's a big step for doctors treating COVID-19 in Brazil. And it's something that doctors in countries all over the world would like to achieve.
Was fantastic.
That is amazing.
Prayer, God, I thank you, because I'm just in this fight against the vaccine group. No, it's not because I'm against the vaccine, not. It's because they don't let us to treat people what they are needing now. It's just few people that has receiving a vaccine. And as a matter of fact, we don't know if they will be really protected, because the vaccine they are receiving here is 50% protection. And the ivermectin gives 93% protection, understand? And so that's the point. But they have a lot of influence in the mainstream media. And we have much more influence in the social network, in smaller media. And this day, people are not so easy to be confused, is one thing I have I perceived. I gave one interview in a radio station in Bahia, and just after I speak about ivermectin, how we can use to prevent, how we can use it to cure, and just every pharmacy know ivermectin in the same night. No one could find it, and was so many people that ask for the medication they do not have. They went to Goiânia with car, 2,000 kilometers, a factory that produces ivermectin.
2,000 miles to go to the factory to pick up ivermectin.
Several times this happens.
Wow, that's interesting.
I gave another interview in another city in the Northeast, the same. Disappear all the ivermectin from the pharmacy in the city. And so another thing interesting, this is decision of the population. We have many cities that decide because the people believe what we are saying. But in Itajaí, the mayor was a medical doctor. He talked with me. They before they decided to give the medication for the population. And so we have done a protocol with him. So we gave all the instructions, all the questions they should be asked by the doctors. We oriented for medical consult before give the medication to know if they have other problems. And the doses, the frequency, and they started to distribute the drug in a big space they have over there. And after that, all this data was computed. People who has 1 dose, 2 doses, 3 doses, and so we also compare with the people who do not want to take the medication. So it's a natural control. People from this city, they have digitalized information in the health center of the city, okay? Able to identify exactly who received how amount of ivermectin, who took the first dose, the second dose, the third dose, what was the disease, where they live, what they do, you understand? And all this was put in the computer, all the answers they gave for the doctors, and we received this information just in January, all this, complete.
How long did your protocol go on for?
I think was about 2 months.
And how many doses did you distribute?
3 doses. So the first dose was reach about 40,000 people. But the second, 20,000, you understand? So in the end, the 3 doses who received was about 10,000 people. We have 10,000 people of control. Was not bad at all. You understand? So it's not just people say, we give to everyone. No, it's not like this, because there is people who receive the first, but not the second, who never take any dose at all. Here we have absolutely control who receive, how many receive, how many doses. And now we observed that the people who is old, just recently, a little bit before, we talked that the vaccine is not working well with old people. Well, with ivermectin, the older group was more protected. Who took was protected. You understand?
Yes.
And for young, not so much difference, because they are not so affected by the disease. So it was exactly what we need.
Your study is incredible. Now, you've brought all the data in as of January 2021, and you've actually managed to get the hospitals to participate in your studies too, which is groundbreaking, getting all the lab and data on the patients being treated for COVID-19 in the hospitals. That's really wonderful.
It's hard work to talk with many people. So we have received all the laboratory tests the patients have done. Enzymes from the liver, from the heart, function of the kidneys, and we discovered that people who has received the ivermectin, they have protected more the kidney, the heart, and the liver. You understand? Mm-hmm. But now, with the ivermectin, these three main organs we could check and were better. And when we double the doses, we have better result.
Lucy, can you go over a little more about the organ protection? Because I want to know more about this.
Yes, this is very important because no one had explained this. Was that we receive all the information of these people that are in the intensive care, and they have every day tests, blood tests, urine tests, to know how the thing is going well or bad. And so our statistical said, it's not enough to know if they die more or less with ivermectin, but we have to double check and see how was the laboratory tests function with the ivermectin. And everyone was better when the people are receiving ivermectin, much better, you understand? And double the doses, better yet. Let me tell you one thing, not everyone. You cannot manage this completely. We just received the data. And the data was very heterogeneous, like we would like to be. You understand? Because it means that it represents the whole population. And there is a group of persons that do not receive ivermectin because it was the beginning of the experience, and they are in intensive care, but receiving what they think is better. And after that, we start to give ivermectin. For one group, a lower doses, for another group, a double of these doses. And also we compare with the blood test, and we saw, first of all, that the ivermectin was very, very important for survival. And second, bigger the dose, better the results, and also better the protection of the liver, kidney, and heart.
Wow, that's really interesting. Now, when you said you were giving bigger doses, how much higher were you going with your dosing of ivermectin?
We doubled the doses.
Doubled.
The usual dose is 0.2 milligrams,
Yes.
and the 4
Per
kilograms,
kilogram. Yes, yes.
and the double the dose. So that's it. I think, and we have many cities that we know they are having good results. Like I told you, the Natal that has no more chikungunya, Zika, dengue, and they are having good results of administration of ivermectin, and also decrease the amount of cases, but it's not like in Itajaí, only we have everything under control before, during, and after.
That's great.
Understand? And this is something. For this reason, this guy represents us in World Federation. He was very interested to participate because he knew this is a date we don't have in another place in Brazil.
That's
It's
awesome.
unique.
That's amazing.
The Peru was published.
Yes.
The Argentina, but the study was published. And now we are going to publish the Itajaí.
Good going. Good
We are
going.
writing
Yeah,
the
that's
paper.
wonderful. Lucy Kerr, your study is going to be a landmark paper. You have all the qualifiers to make this a world-class paper. I look forward to seeing your preprint. You are doing such amazing work as the face of ivermectin in Brazil. I really look forward to seeing your paper get international attention and help to bring this pandemic closer to an end. And for those of you who are listening, please subscribe to my YouTube channel so you get an opportunity to meet amazing people like Dr. Lucy Kerr as I upload videos on an ongoing basis. Thank you for listening.
I would like to thank you for this invitation. So maybe we can reach more people.
I hope so.
This is what I really want to.